Hi, Adele. Do you want to start?
Sure. I was trying to decide if we should wait a couple minutes to let folks trickle in or if we should just start introductions, but I think we'll just get started with introductions. There's a lot of us. It'll take a minute to go through it all. If you hear us in the background, just come on in, settle down. We're going to get officially kicked off in a minute, but we're going to start with introductions. So good morning or good afternoon, depending on what time zone you're in. My name is Adele Fontenette, and I am the Director of the Tribal Justice Exchange at the Center for Court Innovation. I'm going to go through very quickly and introduce our other panelists. I'm going to say their names, and if they want to give a little wave so you can see who they are on the virtual camera space. So I'm going to be introducing David Lucas and Sheila McCarthy, our Senior Program Managers with our Treatment Court portfolio. Karen Otis, Associate Director from our Treatment Court portfolio, and Medina Henry, the Director of our Community Justice Initiatives in our Technical Assistance portfolio. So you may have noticed there are a lot of presenters today, and that's for a couple of reasons. We're trying to do something a little bit different in this virtual space that we've been given. To begin with, we have a lot of presenters because when we were thinking about building a presentation that focused on the lessons learned from courts throughout COVID, we really wanted to get a diverse spread of experiences because courts in different jurisdictions responded in slightly different ways. So we really wanted to be able to pull from different stories to generate a sort of well-rounded, diverse portfolio of experiences for you guys. The other reason is because we really want to make this presentation as engaging as possible. Because the truth is, if we were doing this in person, this is the kind of space where we would like to create a conversation. We would love to share about the things we've seen other courts do, but we also really would want an opportunity to learn from you. We want to hear what have been your challenges? What have been your workarounds, your ingenious solutions? What are new ways that you did things to try to connect with your participants and your communities that really work? And we wanted to create a space for you guys to share those experiences with us and with each other. So what we're going to try to do in this presentation is we're going to invite different ways for us to engage with each other and share our stories through these technology platforms. So you may be seeing a lot of poll questions, and that's because we want to ask you guys to share little bits of your experiences, and we want you to reflect on what your experiences may have been like in the aggregate together. But we're also going to ask you guys, we're going to drive you to the chat. If you're hearing us talking about things we've seen in other jurisdictions and you did something similar, share it in the chat. If it worked, share it in the chat. If it didn't, share it in the chat. This is really your chance to highlight your stories and to see if they resonate with other people on the other end of this virtual platform, wherever we may be today. So that's going to be it for opening remarks. Thank you all for joining us today. We hope this is interesting and informative, and you have an opportunity to learn from us, from other jurisdictions, and more importantly, from each other. So the main purpose of this plenary is to really talk about how has COVID changed the way that we have learned to engage with each other, but also with our clients. The advent of COVID-19 was a very difficult time for most of us, physically, emotionally, mentally, and spiritually. And it was also, as we learned, difficult for our court systems. And that's because, for many reasons, but one of them is that courts aren't really, they're not known for being fast-moving creatures, right? If you want to make a change in your court system, you have to go through codes, you have to go through policies, you have to go through decisions, and over time it works its way into how we change our practices. But COVID-19 did not afford any of us that luxury. It was a time where the world and our court systems had to adapt very quickly to very limited and challenging circumstances. And because of that, it was a time in our court systems of rapid experimentation and adaptation of new processes, protocols, and approaches. It was also a time where we didn't really have much opportunity to plan or to build. We were building the ship as we were sailing it. But from that experience, there are many lessons that we learned, and we're hoping to really extract those experiences and those stories and those lessons to see if we can have a conversation about were there opportunities for us to learn from these challenges, to think about new ways of engaging our clients and our communities in ways that can lead them to more successful and healthy engagement. Next slide.
Okay.
So we're going to start with a poll question, and I'm kicking it off to Dave.
Okay, thanks, Adele. Good morning and or afternoon, everyone. And as Adele mentioned, my name is Dave Lucas, and I'm going to be our poll conductor for this presentation. So you're going to hear me come on line here and there with some questions for everyone as we go. And hopefully that makes things feel a bit more interactive given the circumstances. But also to, as Adele alluded to, give us a kind of a sense of where everyone is right now in real time, and also where we've been. So hopefully this will be some new information for everyone and will help us feel kind of a little bit. So with that, I'm going to launch the first question, which is a general one. And let's see if this works. Hopefully everyone can see that. If I can get just a thumbs up from a colleague that you can see it. Awesome. Okay. So again, you can select all that apply for this question. So unless you answer the bottom one, which would just be the single answer. And I'll kind of treat this like popcorn. Once the kernels stop popping, I'll end the poll. Okay, looks to be pretty close. Okay, so I'm just going to share those results. Okay, hopefully everyone can see that. So it looks like a lot of attendees were actually from courts that were not using. The majority of folks were using for court, so that was probably good to have that in place when COVID arrived, for some staff training, data collection, some of the standard pieces, but especially for treatment. Looks like almost nobody was using telehealth for treatment. So it'll be really interesting to see how that changed over time. So thanks for those responses. Sorry if I ended it before you got to respond, but I think that's really helpful for setting the table. And just a quick note, if you are watching the recording, to the future audience members, if you're watching the recording of this, we'll attach a PDF of the poll results, which I don't think will show up on the recording. So we'll attach that to make sure you can see the responses as well. Okay. And I'll throw it back to Adele.
Thanks, Dave. Could we head to the next slide? So it was interesting seeing your results. In some ways, I think that echoes what we anticipated based on a survey that we did last year. So before we jump in and start talking about different examples of how we've seen courts adapt through COVID, what we actually want to do is we want to take a minute to step back and ask ourselves, where were our courts before COVID? And that's because when we think about what we could do, what we did do, what we were able to do, a lot of that sort of sits within the foundation of where we were at when COVID-19 started. And tribal courts and healing to wellness courts had a lot of unique challenges that they were dealing with that sort of created, like I said, the starting point or the parameters for how our courts could adapt and shift throughout this process. So what we're going to do is we're actually going to reflect on a survey that we did at the Center for Court Innovation. It was 2 years ago now. Some of you may have even taken this survey. If you did, thank you. And also, this is our first time sharing out the results of it. So you'll have an opportunity to see the results of the survey that you guys contributed to. So 2 years ago, we launched a survey to get a sense of what was the technological infrastructure that tribal courts were utilizing. What was their access to technology and what sort of tools were tribal courts using? And this was really the first survey of its kind. We'd heard anecdotally, and many of us have our own stories of what we've experienced through our own courts, but this was our opportunity to get a broad sense of what was happening with different tribal courts all across the United States. So our survey, I think we launched it in May of 2019, and we closed it in November of 2019. And so what that means is we had this great, amazing data of what infrastructure challenges and opportunities existed within tribal courts. And then 3, 4, 5 months later, depending on where you were, COVID-19 hit. And all of the data that we had gathered, I don't want to say it was no longer valid, but the circumstances in which we had access to technology and were using it were changed very rapidly. So what we have in this survey is actually a very unique snapshot of what access to technology tribal courts had before the advent of COVID-19 hit. So we're going to use this to walk through that data and reflect on what was our infrastructure walking into COVID-19. Next slide, please. So we had 67 people who took the survey. We had a good mix of folks from all sorts of different regions across the United States. About 60% of the people who took the survey were court-based practitioners, but we did have people from other tribal agencies and departments like victim services, child welfare, treatment providers who interacted a lot with the courts also took the survey. The survey focused on data collection. How are tribal courts collecting, storing, using data? It asked questions about what sort of technology access did tribal courts currently have and what was the infrastructure challenges associated with accessing some of that technology. We also asked about interagency information sharing. So we asked about how were you guys sharing information about clients, court cases, case management with other agencies. And then we asked about your use of teleservices and remote technologies. Next slide, please. So we had some interesting findings. We have the report on our website for those who want to read the whole thing, but I'm going to highlight a couple of the really more relevant pieces for the conversation today. One of the things that we noticed was some very serious infrastructure challenges. Of the people who took the survey, only 60% said they had access to reliable internet, and only 45% said they had access to reliable cell phone service. What was a challenge or interesting about this survey is that our survey was done online. So what that means is the people who took the survey were more likely to have access to reliable internet. So these numbers are actually our best case scenario. It's actually likely that the folks who didn't have access to reliable internet couldn't take the survey. So the numbers are probably lower. So what this is saying is that in our best case scenario, we have tribal court practitioners, treatment practitioners who 50% of the time don't have access to the internet and cell phone service they need to communicate with each other and with clients. We also asked about data collection. About 46% of the folks who took the survey said that they collect data electronically, and that could be through like a fancy custom court-based software, or that could be something as simple as like hand-pulled Excel data. That said, 66% of people, so the vast majority, said that they still used paper in some form or another as part of their data collection process. So what that means when we're thinking about challenges in moving to a remote world. If we have our case information, if we have our client information, our case management portfolios in physical paper documents, that's really going to highlight that we're going to have that there were going to be very serious challenges moving remote, because even the way that we share information is tied to physical hard copies. Next slide. So something that we also asked you guys was, how do you prefer to communicate with your clients, or what are the ways that you most frequently communicate with them? And something very interesting, but also not surprising. And I want to sort of state that I think in general, none of this data is surprising. I don't think any of this is going to blow your minds. You're not going to be like, I didn't see that coming. I think most of you are going to say, yes, this is what we've been saying. This has been our experience. But I think there's a lot of power in capturing that data in the aggregate that really affirmed the complexity of the situation that tribal courts had as they walked into COVID. And one of those challenges, or I guess just things to note, is that there was this is what I call a strong preference for interpersonal communications. So I actually listed it in descending order of how you guys prefer to engage with clients. And it is basically the closer to in-person, the more it was used. And that could be for any number of reasons. It could be because it doesn't cost software infrastructure, or you don't need good cell phone service to have an in-person communication. So it could be that, but I also think that it can highlight the fact that there's just a strong preference for communicating with people with as much relationability as we can have. We can ask them what's going on in their lives. We can see what's going on in their lives. We can talk about family with them. We can see how other things are going. And so to me, this indicates that in addition to infrastructure challenges that tribal courts were facing when they shifted through COVID, is you also have what could be a cultural preference that is suddenly no longer accessible. If you can't communicate in person, it really disrupts some of that relationability and personability that we're so used to relying on when we communicate with people. Next slide. We also asked about how you use teleservices, and this is interesting because it pretty much mirrors what you guys said in the earlier poll. Some of you were using it for court hearings, but really you weren't using it maybe that often. 6% said they were using it for client communications, case management. We asked about telehealth, and I sort of lumped different things together here. So when I'm saying telehealth, that included EMAT, that included individual therapy, group therapy, or virtual therapy in group setting. Very few of you were using it before then. Most had never used, and nobody was really using it often. It seemed like it was something that had maybe happened once. But when we asked people, did you like it? Would you use it again? It was actually the people who had used teleservices rated it very highly. And we're like, yes, it created a lot of opportunities for us because of remoteness, because of transportation, court interpreter. We could bring in a court interpreter. So there were a lot of positives that people highlighted in the use of teleservices, even though it was very infrequently used. Next slide.
Okay, so this is a good time to ask this question, and this will be kind of the moment of truth in some respects on this really important piece. So the question is, since COVID-19, has your court used remote technology to provide treatment or telehealth? And so the options are yes, most treatment was delivered remotely, no, all treatment remained in person, or roughly even split of in-person and remote. And I imagine that some of that has changed over time. At the beginning, it might have been all remote, and maybe it's returned back to something a little bit more of a hybrid, but hopefully these answers give us a good sense. Getting a few more. Okay, so we'll share those results. Okay, so that's a big difference. So we went from you know, single digits to 63%. That is a pretty quick response, and really encouraging. It goes to show that folks really kind of figured out quickly how to respond and be creative and find ways, workarounds for probably very difficult transition. And as Adele mentioned, you know, those interactions, those relational moments are so tough to replicate with technology. So be interesting to hear about how folks did that. There we go.
Thanks, Dave. That was very interesting to see. And again, I feel like maybe we could have anticipated it, but that's really powerful to see how quickly people had to pivot, going from like, never have we used or we've used once to like, this is now our mainstay. This is how we're doing things. And we had to figure out how to do it within just a few months. And that's even more powerful given some of the challenges that were highlighted in the survey. So we asked tribal justice system practitioners to share what were some of the biggest challenges that you guys were experiencing in the use of remote technology. Far and away, number one was unreliable internet and cell phone service. That is not surprising, even from the previous data that we showed, but I mean, it was far and away the number one biggest challenge. And then the next ones were sort of supporting to that and really highlighted that it's not just like a simple fix. We're talking about deep infrastructure issues, like lack of access to broadband, the extensive cost of taking in a new software, the maintenance of that software, training of staff if there's turnover to keep using the software. So there were, the challenges that were highlighted were not simple fixes. And there were other issues that people brought up, but like I said, the number 1, 2, 3, 4 issues that came up was just that there was a really challenging infrastructure when it came to using remote technologies. Next slide. We also asked, how did you prefer to communicate with your clients? And like I said, this really, again, reflected that strong interpersonal preference. The ways that we used to communicate with our clients were in person. We would share information with them in person, or we would call them, or we'd have in-person hearings. Or if we needed to distribute information, they would come to court, we would hand them that information, we would flyer at community events, we would participate in large community gatherings, we would do case management and supervision in person, sometimes phone calls, but really the strategies we used to rely on were extremely in person. And that created a lot of challenges for our courts during COVID. Next slide. And so what we want to talk about today is understanding that that was the foundation that many of our courts walked into COVID with. How did we find new ways to adapt, to pivot, to create innovative strategies, solutions, methods of engaging with our clients? And were there opportunities for us to learn from those? Did we walk away with new strategies that we want to keep that actually may have been more successful in some ways, or may have opened more doors for us to engaging with our clients and supporting them through their journeys to wellness? So now we're going to be turning over to a couple more polls to get a sense of how things have shifted for you guys in the past year and year and several months. And then we're going to move on to stories of examples of what we've seen other jurisdictions do to continue engaging clients through the unique challenges we had presented to us during COVID.
Okay, so that brings us to this perfectly timed question, which is, in what ways has technology been a challenge for your court during COVID-19? So a lot of the things that Adele just mentioned are on this list, and you can check all that apply. And we know that even if you did respond in pretty impressive ways that kept your programs afloat, there probably were some challenges. So feel free to click on everything that applies here. Just give me 1 second, bit of a delay. There we go. Should be up. So difficulty with broadband, Wi-Fi, or data plan limitation among clients, purchasing costs upfront, fees and maintenance over the long term, available technology not suiting the court's needs, tech literacy among staff, tech literacy with clients, jurisdictional barriers, HIPAA compliance. All to say, there's lots of things that could potentially make this challenging. And I'm just letting this one run a little bit longer because answers are coming in. And I think this is a really good bit of information for us to have as we think about our technical assistance priorities over the next year or so. Okay, so maybe I'll close it there. And I'll share out the results. Okay, so the leading vote getter in this case was tech literacy among clients. So that's something that we've heard across the country, definitely. I think Sheila will probably be speaking about that a little bit. Wi-Fi or data plan limitations, again, that was pretty common across the country that we saw in the treatment court space. Difficulty with broadband. What were some of the lower? So it looks like fees weren't so much an issue. Jurisdictional issues and HIPAA wasn't so much an issue. So more about just kind of the adjustment to technology, it sounds like, and then also being able to access good Wi-Fi to make those FaceTimes or Zoom calls not so awkward. Okay. And I think we've got another poll question next. Okay. Bear with me for 1 second as I get the next one up. Okay, so where is everyone today with your program's operations? Are you all in person, all remote, a hybrid, mostly in person, a hybrid, mostly remote, or a hybrid, both equally? So far, it's looking like a pretty even split. But interesting to see that a quarter have adapted or have returned to mostly in person. And 15% are still fully remote. That's actually a little bit surprising. That's quite interesting. Okay, interesting. So a pretty even split among the 5 options. I will share out those results in case you can't see them. So it does look by a slim margin like the most common response was a hybrid of mostly in person, which I think would echo what we're seeing across the country, but still is quite interesting. Okay. I think pass it over to Sheila.
Thanks, Dave. Can you go to the next slide?
Yes.
So I'm really happy to be here today. A few years ago, Dave and I were really lucky and actually got to present on teleservices in Palm Springs, which I know we all wish we were in some location together today. But I do think it's pretty interesting just to see all the changes that have happened over the last 12, 15 months, thinking about what I was presenting on at conferences even back in early March of last year to where we are today. And while there have been a lot of technology advancements and evolutions due to COVID, it's also a really great reminder that virtual everything should not be the norm, and that the real purpose of teleservices is to be filling a gap in using technology to support and enhance, but not solely replace that in-person interaction. And so I think some of the poll questions, even as far as, what changes have been made and what people are doing now versus what they were doing before is really interesting. And so just think about the last 15 months in your communities and, what has worked, what hasn't worked, and try to take some of those lessons to improve the court operations, as well as just services that are available for participants now that might have been lacking before. And of course, we're all in different phases of returning to in-person and just redefining what the norms are for operations. I think it's a really good opportunity to just continue to evolve and shift what is known as business as usual in 2021 versus 2020, 2019, and what it will look like next year, we'll have to see. But our treatment courts technical assistance team had bi-weekly meetings with all of the statewide coordinators starting in March of 2020 last year, which I think was a really insightful opportunity for us as technical assistance providers, but really for the statewide coordinators to hear from each other. It provided an opportunity to hear how courts were pivoting, when shutdowns started, reassessing during reopenings, and then shutting down again and reopening, and what that's looked like. And again, just trying to take some lessons learned from some other states and figure out what works in everybody's jurisdiction. And additionally, we were able to send out a national survey and learn about some of the innovative solutions that many jurisdictions were able to put in place. And some of them they felt pretty successful and have been continuing to use now, or just kind of change those a little bit based on what they piloted and what they're going to keep more long-term. And so from that, we created this publication, Treatment Course and COVID-19, and it really just highlights some of the unique opportunities, primarily within drug courts, they were able to stay engaged with clients throughout the pandemic. And these were some of the main themes that emerged across the board. So initially just starting with transitioning to teleservices, figuring out platforms, who had what to begin with. Obviously bandwidth issues can be a huge problem, kind of no matter where you are set up. So taking that into account and just trying to figure out how to maintain that communication, the access to treatment, and general court operations. The second piece, expanding access to technology, how different states were able to provide participants with funding, help out with Wi-Fi issues, if they're able to tap into state funding, federal funding, partner with nonprofits to provide technology for participants that didn't have them. Just trying to be as creative as possible with essentially no planning time since everything pivoted so quickly. Enhancing recovery supports virtually. I think this was a great opportunity to engage with participants that hadn't really been done that much before COVID, but several courts created these closed groups within different apps and website. I would say we heard the most about creating closed groups in the rooms. And from there, participants were able to communicate directly with each other. They were able to access different local, state, changes in the courts, virtual resources that were being updated constantly by the coordinator, and also just practicing stress management techniques in these closed groups. We all know, how isolating everything was and how difficult it was in the last year, and a lot of those accesses to self-care and well-being that really should be done in person, just trying to supplement some of that virtually. And they also just felt that, it really opened new avenues for treatment. A lot of times you need a really specialized group that might not be available anywhere near you. So there were some courts that created gender-specific online trauma groups where, they didn't have an opportunity to send somebody anywhere for some of these services, that now they were able to at least connect with others virtually. And I think some of the opportunities about connecting virtually is that in the room specifically, you're connecting with people literally all over the world, and they have broken down in so many different types of groups that, especially in rural areas, where there might not be that many options, or sometimes people just don't want to go to the meeting in their community where everybody knows them. So again, just trying to figure out what works for some people and what definitely doesn't work for others, and just keeping it as another option, I think, especially when you're doing any type of ongoing recovery supports that are out there. So again, really just thinking about filling the gaps and not replacing what we know works. Adjusting drug testing, of course, in a lot of places, drug testing has just been on hold. In some places, it still is. For some states that wanted to continue to use some of that, they were using oral swabs, video, sweat patches, just some alternatives to what was being done previously for drug testing. And I think really the most interesting theme that emerged was reimagining the incentives and sanctions. We heard kind of from several people that the lack of typical sanctions that are forced by judges, that are not forced by judges, the lack of typical sanctions really forced the judges, the treatment court staff, the case managers, and probation to explore new ways to engage and motivate participants without, immediately resorting to that jail sanction, which we know is so harmful. And so numerous programs reported that participants were more forthcoming with their use when they knew that jail would not be imposed as a sanction. These were specifically in areas where individuals were not being drug tested at all. And I think this is the scenario we all want, right? We want individuals to be able to feel comfortable self-disclosing, to talk about, what their recovery plan is, not relying on that, that drug test and then going from there. And I think that really speaks to the importance of that therapeutic alliance. So I think that was pretty interesting to hear across the board from several states. And before I go through some state highlights specifics, Dave is going to do another poll question.
It's true. There we go. Okay, so we are going to, with this question, zoom in a little bit on more specific practice, in this case, drug and alcohol testing. And we are asking, has your court adjusted your drug and alcohol testing procedures? And the options are, we are back in person and back to normal. We are in person, but following CDC mask and distancing directives. We have reduced frequency and following CDC directives, a hybrid of in-person and virtual, or we're not back to drug testing at all. It looks so far like option 2 is the most popular, which I imagine is pretty representative of what we've heard across the country. Back in person. A lot of courts reached out to us asking, how do we measure progress? How do we know how our clients are doing without drug testing? So it doesn't surprise me to see that most things have returned to back in progress. Okay. So I'm going to end the polling there in the interest of time and just share out those results. So at 40%, looks like most, or the most popular response was in person with their directives. Some folks are using a hybrid of in-person and virtual, but most people are back to in-person. And then there's 21%, actually that's quite a large amount that are not back to drug testing at all. So it'd be really great if we heard from you in the chat a little bit about how you've adapted to that. That's a fascinating finding, I'd say. A quarter of the courts not back to drug testing. I'd like to see how you've adapted and continue to kind of work, adjust your accountability measures for that. That's great. Okay, and moving on, I think back to Sheila.
Thanks, Dave. And yeah, I think that's a really great point. We were asked and continue to be, as far as, how are you dealing with accountability and what are you doing for virtual reporting, and just getting creative around ways to continue to do that. And so that would be great for anybody to put in the chat some creative things that you've been using, and if you plan to continue to use that going forward. So I'm just going to highlight a few of the different states that are in the publication. The first one was Georgia, and I think they were pretty amazing. They were able to fully transition all of their treatment court services. They refer to their treatment courts as accountability courts in Georgia, but they were able to make that transition within the span of 2 weeks. And these are some of their main takeaways. The first being that they believed it was really crucial to have the total number of treatment hours remain constant with whatever their previous in-person schedule was. I will give the caveat that the exception to that were for individuals that were intensive outpatient, because we heard pretty much unanimously across the board, if you need intensive outpatient, being on Zoom, as we all know, you only have a certain attention span. So that was a really, really difficult thing And I would say, if at all possible, not to do that going forward, just from what we heard pretty much unanimously across the board. But the individuals were still able to hear from and speak with the judge directly through video. They also had their accountability court judges record motivational videos for participants, especially when they were doing well, or for people they thought might be struggling a bit, to continue to give some of that strength-based approach, even if they weren't in person. And so the judge would record the video, and then the coordinator would pass it along to the participants. And the participants said, they really appreciated continuing to have that communication with the judge and with the case manager or coordinator. They were also able to partner with local recovery community organizations to continue to have those daily online support meetings. They did social media challenges that focused on gratitude and self-care practices. And then winners were able to get gift certificates for grocery stores, restaurants. We know how important self-care is. I think Dave, Karen, and I specifically in our presentations really try to emphasize that all the time. And so, especially in the last year plus, how are you able to continue to emphasize the importance of self-care and just give a lot of options for individuals? And then just thinking going forward, I've been doing online yoga classes for the last 15 months, which if you had told me before that I would enjoy doing that or want to, I would have told you never. But I also realized some of the benefits. I could do it any time of day and different things like that. So again, just trying to figure out going forward what makes sense, just as far as many options as possible, making it center specifically for your clients. They were also able to partner with local nonprofits for individuals that needed necessity items like cleaning supplies and groceries. I think they had a really good relationship with a lot of their community recovery supports and other organizations and peers in their community. So some of this, I think, due to that relationship, we're able to put these things together pretty quickly. And they were actually one of the first states that we saw where they fully developed new policy and procedure manuals pretty quick. And I think one of the surveys earlier mentioned as far as the tech literacy. And I think that's a really great point. Normally when we go in and we do the teleservices needs assessment and implementation and just everything along the way, we really encourage the importance of creating these policies and procedures in different types of guidelines. We all learn differently. Some people need to hear it, some people need to see it on paper. And so I think especially when you're involving technology, thinking about going forward, all of the things you can put in place to make it as comfortable as possible. And also realizing, this is not a good fit for this person to do anything on technology unless it's a complete last resort. So let's keep that in mind, which goes more into, the assessment of the client and the organizational readiness and some of those other pieces. And they have also, they're continuing to use teleservices going forward. They found particularly in areas where they have a big access to transportation, and also really for individuals that are later on in phases of the program, using it as an incentive, especially if they're doing well, they have a job, they don't want to put this person in jeopardy and put more hardships on them, to be able to use this as an incentive going forward. Next slide. Washington State. So King County Drug Diversion Court was one of the first epicenters in the US for the pandemic. And so they had to pause a lot of their program operations pretty quick and earlier on than some of the other states. And so again, one of the things that they immediately did was make sure that they had participants that were connected with different options for multiple connections, whether that was going to be daily recovery meeting sessions, whether that was going to be focusing on mindfulness and meditation, if it was going to be more grief support, because so many individuals in some of their courts had individuals in their family and close friends that were dying of COVID, having women support, mental health, just all of the different options, trying to be able to give individuals in the community options for different ways to connect. They also were holding virtual town hall meetings, and they had those in English and Spanish, with about 40 participants calling into most of the sessions. And they said they're going to keep that in some sort of capacity going forward, just because they were using it as another forum to kind of bring the larger group of individuals that are in their treatment court together in a way that wouldn't necessarily be able to happen in person anyway, just because they're coming in on potentially different days for case management sessions and court hearings. And if things are going to be changing, this is just another platform for them to be able to announce some of those things. And like a lot of places, they were holding graduations on Zoom. And what we heard from many places also outside of Washington is that, you know, in some ways, individuals liked the graduations on Zoom better, as did some of the judge, because they were able to include family members that wouldn't have been able to come in person to the courthouse. They had one guest that was calling in from her chemotherapy session for a family member that was participating in the graduation. And so they're really planning to continue just to kind of figure out, could we do this if this is somebody that would prefer this type of setting? You know, sometimes I think we think graduations, like everybody in the courtroom is clapping and it's really exciting. That can be really overwhelming for some people and not really feel like a joyous occasion. That can be a lot of anxiety provoking and other things like that. So again, just coming from a client-centered approach to figure out what is appropriate for your participants and what is really going to be a celebration for that individual. And then lastly, to create different ways to connect with others, they partnered with a nonprofit that was Path with Art, and they were able to provide tablets to individuals that didn't have them to be able to engage in online art classes. Again, you know, just being creative. Everybody has different outlets for what they want to do for self-care or for mindfulness. So again, just being cognizant about what's available in your community and who you can kind of connect with to be able to support the participants. And yeah, I think that's pretty much for Washington. Dave, I think there's another poll question for you.
Yeah, okay. So in the spirit of all of the innovations that Sheila just spoke about, we want to know if your court has developed any new incentives or sanctions or therapeutic adjustments during COVID-19. And you can answer here, yes or no. And then we really want you to fill up that chat box. Tell us about those innovations. We want to hear about what you've done differently and how you adapted. I think this is one of the tough ones as well, just like drug testing. So we really want to hear about the creativity out there. Okay, so in the spirit of time, saving time, I'm just going to share it now because the percentages haven't changed in a while. So it looks like 2/3 made no adjustments, which is interesting. So that's a finding in and of itself. So most were able to maintain, I guess, the metric that they were using before, which is interesting. Hopefully for those who answered yes, you're filling up the chat box as we speak, and we're going to try to monitor that and maybe circle back to some of that a little bit later on. Thanks everyone for that. I'll throw it over to Sheila again for some info on Minnesota when that shows up. Sorry, there's a bit of delay.
That's okay. It'll come up, Dave. So Minnesota was one of our other states. This state in particular, we heard more from one of their mental health courts that was located in St. Louis, and to try to combat some of that anxiety and that isolation that a lot of their participants were going through, they hosted these virtual craft and snack sessions, and they had them with participants, alumni, and some court team members. The team was able to purchase and get prepackaged snacks, supplies, whatever was needed for the sessions. Probation officers delivered them to the outside of the participant's home, and they had really positive feedback as far as boosted morale and reduced some of the loneliness and isolation. I will say also, just in general, for some of the other mental health courts that we've heard from, especially depending on individuals with agoraphobia and just heightened anxiety in general about coming to court, that they were actually a lot more active, primarily with their clinical case management sessions, where they might have tended to not necessarily show up for in person, felt a lot more comfortable appearing virtually for court, as well as just engaging with their case managers. And so just kind of looking at, often it's, if somebody's, really not that stable, to have them come in person. And I think really depending on the type of court and just knowing your participants as far as which way they are going to be the most engaged and making that the most comfortable setting, I think is really important. And again, some of the lessons that we've learned over the last year where we didn't necessarily have as much experience with before. Dave, I don't know if it's frozen on mine. It looks like it's still on the poll question.
No. Yeah, I apologize. It looks to be frozen over here. I'm not sure what you're seeing. Just give me 1 second here. I apologize, everyone. 1 moment.
With our technical difficulties, the pros and cons of technology, of which we are all, I think, getting pretty familiar with at this point.
Always the worst nightmare when the teleservices presentation, the technology starts to fail. Because normally when we go into the planning, we say something's going to fail, so what's your backup? So again, this is just a perfect example.
How's that? Are you able to see Minnesota?
Yes, so if you want to just go to the next one for Tennessee, that would be great.
Okay, sorry about that, everyone. Thank you.
No worries. So several treatment courts in Tennessee implemented a way that was a bit innovative as far as, making sure they were complying with social distancing and still engaging with participants. So they actually had these drive-through court sessions and graduation ceremonies. They had, this was earlier on when everybody had to really keep their distance, and, they felt since people were in their cars and or keeping a distance outside, it worked to have a little bit more of that in-person contact that we all know that we need. And so, they even had actually some individuals in their rural areas that just rode their horse into court. And so just, depending on where you are and what you could actually do to see people in person, and I know we were all missing so much and still are, but they were again able to provide coffee for individuals that were there, masks, they had some food delivery for attending, and just so some of those perks that they would have had if they were in person for some of these graduation ceremonies or phase advancements. And so really trying to keep some of that in place. And again, some individuals said that having these drive-through court sessions in some ways had a more deeper connection because the participants had family members in the car, they had pets in the car, other people that wouldn't necessarily have been able to make it in court. And so due to that success, they're again just trying to figure out, could they do something like this to supplement some of the regular phase advancements or graduations or things like that going forward. So I think just kind of keeping an open box for what's out there. And again, normally we try to say pilot this and then see what works before we go full blown, but we are in the situation where we're in. So I think it is really a good opportunity just to kind of redefine how we do everything going forward and not to just kind of default back to what was happening prior to COVID. Dave, I think you got another question.
Okay. So again, in the spirit of everything we've just learned about from Sheila, our question is, has your court identified new ways of measuring compliance and progress? And you can again use the chat to tell us a little bit more about those innovations. Looks like so far our responses are pretty similar to, maybe a little bit more lopsided towards no, things staying the same. Yeah, okay, so I'll share out those results. So it looks to be about a 25-75 split, and most courts have stayed the same. But again, if you've made some changes, we'd love to hear about that in the chat. Okay,
And it looks like it's over to me now.
Okay.
So
Take it away, Karen.
thanks, Dave. And I want to welcome everybody again, since we didn't get a chance to say hello. We appreciate you being here and you sharing what your courts have been doing. And so whether you make changes or not, it would be great if you would drop in the chat the reasons you did or the reasons that you didn't, because all of this information is really helpful to all of you and your peers when it comes to COVID-19. But we've all learned a lot of lessons from COVID-19, especially how we work with our clients. We've had to rethink how we engage clients and what that means. We've had to figure out new ways to incentivize participation, redefine success, redefine progress, redefine compliance. We've had to learn to respect client autonomy and not be so concerned about punishing and or oppressive about supervision and monitoring, and hoping that clients and giving clients the capacity to really work on their own and discover their own recovery needs. And we've also had to really incorporate technology in a very efficient and effective way, as Sheila has just talked about. And so in learning about those things, we've also learned about ourselves. We've learned about how we do our work. We learned about how we engage. We've had to reimagine everything, how we engage with our family, our friends, our coworkers, our peers, the clients. And so in the same way we had to deal with that, our clients had to deal with those same struggles. However, in some cases, their challenges were a little bit more. They've experienced the isolation, the additional mental health challenges, the financial, housing, and food insecurities. Again, Shayla mentioned the grief and the loss, and their barriers to treatment and treatment access, and also the health disparities that go along with that. And some of those health disparities are racialized health disparities. And so when we showed you the ways that the courts have adjusted to access to treatment, supervision, and monitoring in the light of COVID, but we've also really had to redefine client engagement by empowering clients to have a voice in their treatment process during this time. And we had to learn to trust them to identify their needs in the absence of the usual supervision and monitoring practices, which is testing. We rely very heavily on testing to figure out what someone's doing in their progress. And this is not only a shift in the way that we think, which is a good shift, but it's a positive shift for clients as well, because that, again, empowers them to help with this process. It is, at the end of the day, their process. So when we work collaboratively with clients to address treatment and goal setting, we are not only benefiting the client's recovery at the end, but we're also benefiting the court to do its job and be more successful. And so how is incentivizing participation happening? Sheila mentioned a whole bunch of ways that different states were doing it across the country, but courts discovered that additional ways to incentivize participation was really to think outside the box. We've had to adjust our clinical and case management skills to really empower, communicate, and listen to what clients' needs were. And we had to be more collaborative to ensure that we can help them set the goals that they needed in ways that we had never really considered that before. Again, we rely so much on testing as a way to indicate progress and success. So we really had to focus on individualizing the treatment. We really had to use the technology to provide additional options and encourage the clients and allow them as many pathways as possible to success, since we had limited access to them in an in-person state. Because we had some clients that were still working, we had clients that had childcare issues, transportation concerns, health concerns, all of those types of concerns. And they were able to engage in activities using technology if they had access to it. So they were able to engage in treatment, counseling, peer support groups, as Sheila had mentioned, educational trainings. They were able to attend court hearings, case management appointments, phase advancements and graduation ceremonies. All of those things are beneficial to their recovery process, but also beneficial to the court to try to maintain some stability for our clients. Additionally, we had to find new ways to measure success, progress, and compliance. And it's interesting that the last two polls actually fell heavy on the no, that things hadn't changed. And that sounds to me a bit more of a structural issue. And that's why we are asking for some of your feedback, because there are lots of ways now to take some of this COVID-19 lessons into the future and using technology to support those client gaps that we don't have to help move our clients forward. So we heard lots of clients, and Sheila mentioned this as well, that they were more open and honest during this COVID-19 period. And that was for lots of reasons. One, obviously, the limitation of not being tested, but there was also this connectivity that happened when you allow clients to be empowered. And so whether it be a client was talking about a relapse or talking about considering using, they were able to talk more openly. And that's a wonderful process. And they were doing that without the prompt of testing, because some courts they weren't even testing, period. So if you weren't testing, period, and the client is still being open and sharing, that is a good sign. That is an open form of communication. In addition, in some courts had decided that if a client did share that they had used or they tested positive, if they were using any testing methods, they didn't sanction the clients. They decided to continue to engage the client in the sharing process and incentivize them to share even more and looking for ways to support the client going forward. And that really is the work that we are supposed to do. And so thinking about shifting the way that we view client engagement as from a standing of not a gotcha, but a more collaborative approach, looking at sanctions not as a way to catch a client because we didn't have those options, but more of a way to address a client's needs. This is a lot of the lesson that came out of COVID-19. And so some jurisdictions actually admitted that based on COVID-19, if there is a silver lining, there is a more trusting relationship between the court and the clients, that they have then empowered the client. And the client is the one that is at the table and helping drive what they need when it comes to their treatment services. So, because we rely really heavily, as we said, as the clinician and case managers, we were relying on testing to tell us, but we have these clinical skills, and we had to rely more on those clinical skills during this period. We had to communicate better. We had to listen more, and we had to pay closer attention to behavioral changes in our clients to help figure out what their needs were. And so courts are measuring success, and they measured success and progress and compliance in all different forms of how they engage with their clients. You know, if a client responded to text messages or video chats or attended an online class or pro-social online class, as Sheila mentioned, or pro-social activities, or they provided support to their peers, these were all ways of measuring progress and success. And these activities were not about just monitoring supervision, they were about engagement. We also learned that we can respect clients' autonomy. And that was a big lesson for all of us across the board, is that we discovered that clients are more resilient than we give them credit for. They may have far more obstacles, but they are also have the ability to maximize their resources. And clients were able to adapt quickly, and in some cases more quickly than the actual court teams when it came to shifting to COVID-19 policies. So COVID has allowed the clients to be more self-reliant and more self-determinate, and they've been able to participate and engage more authentically. And these are crucial skills that support long-term recovery. And so instead of in the future underestimating clients or putting clients in a situation where we automatically believe that they're not being honest or they're hiding things or they're being sneaky, allow ourselves to empower the client to be resilient. Because if a client isn't being honest or if a client is struggling, we want to set the stage so the client can feel like they can be honest and know that they're going to get the supports that they need. The clients know themselves the best. They know their struggle the best. And if we include them in the treatment planning process, if we include them in the program improvement process, meaning improving your program operations, and if we develop a feedback loop at every stage of the program, the clients will guide themselves and the program to success. And so we have to think about that shift from the gotcha to the you got it phase. So additionally, we want to embed motivational interviewing in each phase of our treatment program from the intake to graduation. And so that's one way to really empower collaboration, communication, and goal setting from the client's perspective. And so using motivational interviewing, you can use topic-centered ideas in your motivational interviewing session. So I want to give you a few ideas on what your topics can be. You can talk about proactive and reactive strategies, and you can explore thought patterns and beliefs and how that affects behaviors with your clients. You can identify techniques that promote emotional regulation, promote adaptability. You can develop tools that encourage boundary setting and improves communication for clients. And at all costs, you want to talk to your clients about being safe and discussing safety options. And so the final lesson that we learned is technology is no longer an innovation, it's a necessity. Sheila had mentioned that we have been doing teleservices presentations and work for a couple of years now. And most people said, yes, this is a great idea. Yes, I can see how this might work. But a lot of courts had not embraced it. And by the nature of COVID-19, this was not an option. Most courts did not think 15 months ago that they'd be using technology in the way that they have. And so technology has really supported us through COVID-19. And so if you're going to be using it forward, and a lot of you should, figure out ways that technology can really fill gaps for your courts and figure out ways that you can help enhance your courts through technology, then we also need to ensure that clients have access to technology moving forward. And so courts across the country are definitely going to continue to use technology in their daily operations, enhance how they use their broadband or their internet. But that being said, we have to ensure there is equity for all clients when it comes to the use of technologies, equity in the access to equipment, to broadband, to internet, as well as training and really appropriate training to ensure that clients know how to use the technology effectively, because if they can use it effectively, it will only benefit their lives and their recovery process. So that being said, that's a wrap up of some of the things that we've learned. So I will kick it over to Dave for another poll based on all of this information that will be lessons that we've learned.
Okay, thank you so much, Karen. That was awesome. So the $1 million question, after everything that we've seen and learned, what uses of technology will you continue to use through COVID-19 and beyond? And I'll launch a poll here. Let me know when you can see it. There we go. And the options are remote court appearances, remote treatment, remote MOUD appointments, during supervision, remote staffings, team meetings, virtual trainings. Interesting to see so many virtual training and education. You'd think folks were ready to be in a room together again, but maybe they want both. Maybe they want a hybrid. They just want options. Remote court appearances. That's good to see. I think that's going to be used frequently, as Sheila mentioned, as an incentive for clients when they're, say, working or have other obligations to be able to tune into court. That's great. More treatment, which is awesome to see that up from, I think 70 or 80% of folks said that they wanted to use teleservices for, so up seeing that 40% will be probably using that going forward is a great development. Lots of people have reported liking it for staffing, seeing that there's end it there for in the interest of time. And I'll share out those results. So 82%, number one answer, people are interested in doing more training and education virtually. That makes sense, especially for folks who don't live in urban areas. I imagine that's again, mother of necessity, of invention. And looks like court and remote staffings are going to be carried through for a lot of courts. Okay. Thank you for that.
Thanks, Dave. So before I hand it over to Medina to talk about community courts, we'd like you all to share some stories with us. We've asked you to drop a lot of information in the chat because we know that this is really helpful for us, but it's also helpful for your peers and your colleagues. And so we'd like you to share some stories of the most interesting and effective strategies your courts have developed to improve client engagement during COVID. So just drop it in the chat, and then we'll try to share what we can at the end of the session. And if not, we will collect those stories and make sure that they're part of any materials that we share. Please use the chat, not the Q&A. So we look forward to hearing what you're sharing. And so now I'll kick it over to Medina.
Thanks, Karen. Hello, everyone. I'm very happy to be with you this morning / afternoon. I wanted to spend some time talking about generating new solutions, which really ties into the conversation we just had about lessons learned. The lessons learned process that we've all gone through in the last year plus has allowed us to work differently and think through things differently. Something that we saw a lot of in the community justice portfolio, along with other jurisdictions, are some common themes around peer exchanges and collaboration and engagement, specifically with service providers. One of the things that really, helped us to all stay connected was by leaning on each other to share ideas. And so in this period of COVID, it became even more pivotal for us to lean on listservs, or group calls, virtual meetings, and other platforms to share ideas and to problem solve. Oftentimes, the change that we see in our court systems is relatively slow. And as everyone stated, this process required urgency and immediate responses. And so the result of that is that many people were able to sort of come together and think through things and move forward with a plan of action. And we hope that many of those plans of action and that process of leaning on each other to share resources and to think through ideas will be sustained going forward. And so sort of formalizing some of the working groups or mechanisms for getting and disseminating information in a more timely fashion really became, an essential part of figuring out how to work in an ever evolving, world of COVID for many of us. Another component that many folks sort of end up having to spend a lot of time working on is developing relationships with your service providers and treatment providers, and they are a part of the core collaboration for many of our jurisdictions. And so what we saw is an enhancement of those relationships and an expansion of many of the partnerships outside of traditional partners, and courts often becoming a vehicle or mechanism for getting essential services to clients because they had, the understanding of where people were and were able to connect those valuable resources. And also thinking through other grant opportunities that help to build resources out, folks being able to receive cell phones and tablets to connect with service providers, or even just, improve their isolation and connect to family members and loved ones. So common themes that we saw were a need to enhance and to maintain these exchanges. One of the great things about being able to come together in a conference platform is that you have the opportunity to, share ideas and to collaborate. But when we are separated physically, we have to think through ways to connect, and using platforms like listservs and workshopping calls really allow for that ongoing communication and knowledge exchange. So I am going to move on to the next slide. We are running short on time, but I wanted to spend some time talking about a really vulnerable population that many of us serve. Next slide, please. So COVID really exacerbated the challenges of some of our court's most vulnerable participants, specifically those who work with homeless clients. Many lost contact with some of their participants, and it's been really challenging to re-engage. So a lot of folks have thought through ways in which you can access and engage these particular participants. And one of those things is taking the court outside of the courthouse, and looking to have, virtual court appearances by having judges and prosecutors and other service providers available remotely, while also being social distance and allowing those individuals to get access to much needed services. This image that you see before you here is an example of a mobile pop-up, and they basically bought a kiosk and people were able to sign in. They also bought service providers to be available on spot. In addition to the mobile pop-up setup, a lot of others have considered thinking through coordinating services or virtual court or mobile court with other key service providers that are serving this population. One of our jurisdictions worked with the local Salvation Army, who had provided meal service twice a day to many of the homeless clients that were being serviced by the court. And they coordinated to have a warrant clearing day. And so they were able to address some of the outstanding court issues that some of the clients were receiving, but also have some essential health services available to connect them, and also to follow up depending on if they had any other outstanding mandates. When this whole situation hit, it was very hard to imagine being in person again. It was very hard to imagine how could we help those who were most vulnerable, but thinking through ways in which we can reduce barriers has been an essential part of reconnecting with those who were seeking to support through treatment services and other needs. I think that we have learned a lot throughout this afternoon about the various ways that we can adjust and adapt. And one of the things that we have seen with many of the jurisdictions is that people are very adaptable, and a lot of lessons have been learned in this process. And a lot of things will continue to, maintain in our new life of post-COVID, hopefully in the very near future. So I'd like to pass it back to our host, who will spend some time having a little bit of Q&A and discussion. Some of the stories that you've shared with us, we hope to share out with the larger group. And again, thank you for your time.
Karen, are you going to jump in, or should we unfortunately wrap up because we're out of time? Oh.
I was going to jump in, but I don't know if we have, can we continue? Should we?
I think out of respect for everyone's time and the next workshops that are coming, and the reality that we all sit in Zoom chairs and need to get up and move around a bit, maybe we should wrap it up. But we wanted to thank everybody for coming today. Thank you for sharing your stories. Thank you for listening to us as we share different stories. We were really hoping to create a space to honor your experiences and the struggles that we have all been through throughout this past year, and to create an opportunity to reflect on those and pull out the opportunities, the lessons, to think about ways that we can continue to build meaningful spaces for our clients and our participants and our communities that support their recovery and wellness and health and safety. So thank you everyone for participating, for listening, and for contributing. We appreciate it so much. Thank you.